In tonight's Health Edge, an alarming new look at how many people die each year from medical errors. It's now the third leading cause of nonviolent deaths here in our country.
Chief Health Editor Dr. Partha Nandi joins us now with a closer look at those numbers and how you can protect yourself.
Yeah, it's pretty shocking. In a new study from Johns Hopkins, researchers suggest that medical errors account for at least 251,000 deaths in the United States. That's more than respiratory disease, accidents, strokes, and Alzheimer's. So it's pretty scary.
All right, Doc, so what kind of errors are we talking about?
So, we reached a point where an average patient, guess what, they come in with 20 medications and have 10 different medical issues. So that's a lot. So it can be very hard to sort it out. And the medical errors noted by this research includes everything from medical mix-ups, surgical complications, to communication breakdowns when patients are handed off from one department to another. So it's very unfortunate that some people are dying from the care they receive rather than the disease or health issue they initially sought help for. So a lot to learn from this.
One of the potential consequences of this is that people might stay away from a doctor when they actually need the help. What advice do you have to give?
That's a great point, Curtis. First of all, I do not want people to be afraid of hospitals. Hospitals are constantly working to improve patient safety, but you have to be engaged in your health care. So you got to be a healthcare advocate or health hero, as we say. So I'd like to share with you the steps you can take to protect yourselves and your loved ones. You hear my prescriptions. So number one, advocate for yourself. A passive patient is less likely to get well, so take an active role in your health care. Second, communication is key. Asking questions, don't be afraid to ask questions, and providing information is very crucial to good health care. Also, bring a friend or a loved one. Another set of ears and eyes can help you understand and know your situation. And also, finally, very important, watch medications. They can be the most common error in hospitals. Write down any new medications you get, and don't be afraid to ask what it's for, how long you'll take it, and what sort of side effects to look out for. It's really important. I'll tell you, with my dad, when he was ill, I remember he's not diabetic, and I was sitting with him, and they gave him an injection. I said, "What is that?" They said, "Insulin." I said, "You know he's not diabetic, right?" And
wow.
They said, "Oh, wait a minute." And so it happens every day. So it's very important to be involved in the care. That man, my dad, gets insulin, it may be over for him. So it's that important. Every step is that important.
Wow. And you're a physician. It didn't happen to you.
Jeez, there's a trust factor that you have with your physician that if you just don't have that, it makes it hard, even for your own treatment.
And what I want people to say is that I'm not blaming doctors or nurses. It's just human error. What we have to do is get the system better to correct that. So I know we do have a question as well, right?
Yeah, melanoma, the other day, we got a viewer question. She's African-American. She wants to know if she has the same risk.
Important question, because lots of people of skin color like me think that you can't get cancer. So they think, I'm immune from cancer because I don't get a tan, I don't get sunburn. The truth is, African Americans can get melanoma, very important, in areas like the palms and soles and toenails, so please look out for it. Early detection, 95% curable in everybody.
Yeah, you need more than just your natural sunscreen when you're darker skinned. Thank you so much, Dr. Nandi. And if you have a question or a health concern for the good doctor, you can email him at drnandi@WXYZ.com. Send it to us Facebook, Twitter, Docs on Snapchat. Any way you get it, we got it.